Let's look at this example. We have a 7-year-old boy who was admitted with fever. He was diagnosed with Kawasaki disease. The next anticipated assessment include what? Select or apply. And you guys know how I do my select or apply. I think this is the most detailed strategy you can have. First, you have to know what is you being asked to do. So that's your ask. And your ask is the last portion of the sentence, the next anticipated assessment. So what is the next anticipating to see? Expected finding, okay? And then the case we already read it. The patient was admitted with fever and was diagnosed with Kawasaki disease. So we know the patient now has Kawasaki disease plus fever. Then we come up with our buzzwords. What are the buzzwords? These are the keywords that you got to figure out. Okay, the keyword is you're looking for an assessment, okay? An assessment. Don't find anything. It has to be an assessment. The answer choice has to correspond to an assessment. And patient has a Kawasaki. So that's the second buzzwords. And we know he has fever, but it's irrelevant. So buzzwords are somebody who have Kawasaki disease and an assessment finding. And then you rewrite it. This is where you bring your content. What are you rewriting? I have a patient who has Kawasaki disease. What would I see if I assess the patient? You've taken command of the question. And then you tell yourself, okay, what is Kawasaki disease? Then you use that to answer the question. After you rewrite, then you make a choice. So just a quick content level to give you guys some quick content. Kawasaki is a vasculitis, basically inflammation of your vessels. It affects every vessels. The most common vessels is the coronary artery, which is the dangerous one. And the risk factor is aneurysm. This is number one. So it causes aneurysm. And that's why this is very dangerous for this patient. There's a way I remember this problem, I call it cream, okay? And the C is a bilateral conjunctivitis. So the eyes, both of them, they have conjunctivitis. Then they have rash that start from the neck that run down. So rash, and this rash is like erythematous rash or maculopapular rash. And then they have a low level of albumin from the inflammation. We don't know what we think is immune response to some viral infection. And so they have edema and low level of albumin. It's because of albumin level is very low. So they have edema. And then they have lymph nodes is very big, and usually the lymph node in front of their neck, so anterior and cervical lymphadenopathy. Lymphadenopathy is LAD. And then the M is the mucositis. So their mouth is really, really red, and there's erythema, it's swollen, they can't eat anything, so there's inflammation in their mouth, so mucositis. And this is where the strawberry tongue come from. So that's how I remember it. So it's cream because it's a rash on the kid and who has fever. And so they have fever. The last one is fever. Okay. So they are, which they already told you. They have fever, and the fever has to be greater than 5 days. And so I cannot put the fever in the formula, so I put cream. But you have to know that this fever is the number one signs of symptoms they will come in with. And then the rest is cream, fever and cream, okay? So based on that, we're going to use that to answer the question. You can see how the SATA usually come around. It's because of the signs and symptoms. This is the signs and symptoms, and they just put it together, and you have to figure it out. So patient has a fever greater than 5 days. If it's not less than 5 days, it's not Kawasaki disease. Descending rash. Yes, the rash starts from the head, from the neck, and go down. They have bilateral conjunctivitis, right? They have strawberry tongue. So, and they have edema, and they have a lymphadenopathy. The lymph node usually is greater than like 1.5 centimeters. So it's a really, really big node. Because of this strawberry tongue, they don't want to eat, they dehydrated. So dehydration is a key. Number one priority for this patient is coronary aneurysm. So this is number one. That's why we treat them. And that's all. That's your SATA right there. Straightforward, just based on signs and symptoms. If you know it, this is not like it's not hard. And the way I treat it is I look at each question, each answer choice, and I just basically don't compare. It's independent. I know I don't compare with this one, and I choose it, and I move on, and I start from the top to the down. And that's how you answer SATA question. So the same question, I'm trying to give you the key things the way they can ask these questions in different ways. So when you study, I want you to do that just for your exam's sake. Every way, as much as possible, anticipate what the examiner, start thinking like the examiner and think what they're going to ask you. So a 7-year-old boy, the same thing, was admitted with fever, was diagnosed with Kawasaki disease. The next should anticipate which of the following. The same SATA, you go through the same thing. Your ask is the last one. Now we're dealing with which treatment action. So our ask is no more an assessment. This is treatment. That's why you got to go through the process. Our ask is treatment. But our case is this the same. Our buzzwords, now we have to include treatment and then rewrite Kawasaki, what treatment action should I do? And then you come out, you say, okay, what is the problem? They have vasculitis, right? And what is the number one thing for them is coronary artery aneurysm, okay, and fever. These are your friends. And your treatment is based on these two. We need to decrease their fever, and we need to prevent aneurysm formation. And therefore, you take that information and answer the question. Encourage fluid intake. Yes, because of the fever, the kid is dry, his mouth is all sore, he doesn't want to drink anything. You got to improve that. You got to force them to drink. So, or you can give them some IV, but usually they can drink. So you can force them. The more they drink, they feel better. So encourage them to drink. Aspirin. I know you said what are we doing with aspirin? I know we cannot give a kid with aspirin who had fever and with the suspected of UR symptoms. Yes, this is the only one that you can give them aspirin. It's very, very important. The aspirin prevents coronary artery aneurysm. It prevents the aneurysmal formation of the vessel. Therefore, this is the only condition when you see an aspirin as a choice, you have to pick it because it will prevent aneurysmal formation of the coronary artery, and that will prevent the kid from having that problem. So this is right. Immunoglobulin. So immunoglobulin is usually the reason why we give them is also to prevent aneurysmal formation. The two medications has to be together. At the same time, the kid albumin is very low. And so we need to increase the albumin to prevent the edema. And so we give them this. Strawberry tongue, right? The next you expect which treatment action. Strawberry tongue is not a treatment. This kind of information, you know the thing, and then you put things there that then they will trick you. Strawberry tongue is not the treatment, it's an assessment. I intentionally left it there as a demonstration. It's an assessment finding, it's not a treatment finding, it's not part of our buzzwords. There is no assessment in our buzzwords, so therefore, no, this is negative. BMP, think about it. You know your underlying problem. You always go back to your rewrite and your buzzwords. Your rewrite give you the content. We know that the kid has low albumin. Well, and if I'm doing treatment, I need to check how low is the albumin. BMP will give you albumin level of the patient in terms of their protein, basically. it depends on which hospital you are. Sometimes some people put CMP, but some hospital can get a BMP and be able to get that albumin level. Monitor for fever, and somebody can assume that this may be wrong, but it can go either way, like either CMP. It depends on the hospital. Like I told you, I know some CMP, definitely you get albumin, some BMP, not all the time. So it depends on your hospital. Monitor the kid for fever. Yes, fever is number one. So far as they having fever, then they lead into aneurysm formation. You want to break the fever. That's why you give them the aspirin. So you monitor them for their fever. And this is your treatment function that you can use basically. So that's another SATA form. And the first one was a assessment. This one is treatment. And so you can see how they can ask you. The last one, then we're done. It's the same thing. I have not changed anything. The boy with the fever, with Kawasaki disease, which of the following require intervention? Something has changed. Intervention require immediate action during discharge. So our ask is what? Immediate action. We have to intervene. But our case is the same. Our buzzwords, we have to include immediate action. We have to intervene. And then we analyze the thing, the same thing. So we got to look at it and say something is wrong. We know the risk factors. We know the treatment. Matter is going on. If he says something wrong, we intervene. It's due for nasal flu vaccine. Negative. If the kid get immunoglobulin, the immunoglobulin, you cannot get live vaccine. So any of the live vaccines available, varicella, MMR, so MMR, you cannot get it, like measles, mumps, rubella, varicella, the oral form of polio, and the nasal form of flu. These are the live vaccines. So no, this one, you got to intervene. The kid cannot get flu vaccine. That is nasal. I will call if fever does not resolve. Yes. Presence of fever means ongoing aneurysm. So this one, I don't need to intervene. Being sleepy is fine. No, this is not fine. Remember, the kid get aspirin, okay? What is the risk factor for aspirin in the kid? Is Raynaud syndrome. And how does it present? Encephalopathy, okay? Severe liver injury, and the kid will become encephalopathy. If he's sleepy, I'm not going to be fine. I got to make sure he's not getting Raynaud syndrome. So you tell the mommy to be watching out. I know we treated them with aspirin to prevent coronary disease, but they can have Raynaud syndrome. Then you ask, why do you do that then? Well, the risk of dying from coronary aneurysm is more than that of having Raynaud syndrome. You can monitor them for Raynaud syndrome, but to prevent coronary structural damage from the artery is more important than something that can encephalopathy that can occur because of the liver that will recover itself. Therefore, does need intervention. I will encourage fluid intake. Yes, the kid has strawberry tongue, they have chapped lips, they're really dry. Even though they have edema, you need to encourage fluid intake.